For more than 2 decades, safety net hospitals, community health centers, and public health clinics participating in the 340B drug pricing program have partnered with community pharmacies to care for patients with low incomes and those living in rural communities. The 340B law requires drug companies to discount their prices for eligible outpatient drugs to safety net providers, who then invest the savings into serving more patients and offering more care. Hospitals partner with community pharmacies to stretch resources even more. When a hospital's patient receives an eligible drug from one of these pharmacies, the hospital gets resources needed to expand care. These partnerships have worked for safety net providers and their patients who live with low incomes or in rural communities where health care is scarce. But beginning in July 2020, some drug companies have started breaking the law by denying 340B discounts on drugs dispensed at community pharmacies. Among them are the 3 major producers in the U.S. of insulin, a life-saving drug for many of the 34 million Americans living with diabetes. By targeting these partnerships, these drug companies are costing hospitals millions of dollars in extra drug costs and taking away vital resources used to care for patients who rely on the healthcare safety net. These drug companies are keeping those dollars for themselves and for their shareholders. More than half of Congress and the state attorneys general have publicly denounced these actions and urged the federal government to stop them. And in May 2021, the government sent letters to the drug companies telling them that they are breaking the law. They ordered them to submit plans for restoring 340B discounts and refunding all of the overcharges. But the companies went to the courts to try and stop the government from enforcing the law. So this dispute continues. The bottom line is, this must stop. The drug companies must follow the law, restore 340B discounts on drugs dispensed at community pharmacies, and refund the dollars they owe so these safety net providers can serve their patients in need. The time to act is now. Protect patients. Stop 340B cuts.